I want my family to know I'm not giving up the fight. Give me a chance. That's all I ask.
She's alive. She's alive and kicking. That's what counts.
Waking up in the middle of the night in cold sweats, going from making a living to making nothing.
It's so nice when people pass you by with a car and they're waving or blowing the horn at you. I'm certainly no hero.
Hi, I'm Jessica Holmes.
It is moi, Celine Dion. Why my shaggy health in quarantine?
Hello, I'm Donna Friesen. One of the many things in short supply these days, apart from toilet paper and frozen peas, is humor. It's hard to laugh when there's this invisible virus lurking, and there are all these limits on where we can go and what we can do. And if you are sick or if you've lost a loved one, this is not a funny time. We're going to get into much of that, including the crisis inside hundreds of care homes. We worry for our families, our physical health, and our financial health. And that mental health, experts say, could create a looming echo pandemic of mental health issues. It's why Ottawa and the provinces have launched initiatives to help us cope with this new reality. And that's where we want to start tonight, our well-being and how we can get through this together, because the coronavirus should not put a stop to our collective sense of humor.
More about me, I'm training for a 1K.
Jessica Holmes has been doing comedy for a few decades now.
You should set achievable goals, is what the experts say. And so I'm not going to rush it. I just had a baby 8 years ago, so, chill out.
Known for her celebrity impersonations, whether it's a Spice Girl.
I'm Jerry Halliwell, but I don't have to say that to you because you know I'm very famous.
Or Celine Dion.
I want to wish everybody in the world one special gift, and that is the gift of my talent.
She's become famous not only for her impersonations, but for this confession.
Hi, I'm Jessica Holmes. I'm a comedian. I've experienced postpartum depression and regular run-of-the-mill garden variety depression. Neither was great. Both sucked.
She wrote a book about it, Depression, the comedy, a tale of perseverance.
Running is my meditation. Meditation isn't my meditation because I have the world's shortest attention span.
And now she, like the rest of us, is trying to find the funny side of life in lockdown.
Put some pep in your step.
And imagining how celebrities are coping.
I believe that the virus goes on and on. So lavez les mains.
And there's the harsh reality of personal grooming.
Hey guys, I'm coming to you from the future. Time travel is possible, and you don't need to buy any more toilet paper. What I wouldn't mind is if someone picked up a pair of tweezers. Tweezers! Just remember to pick those up.
And Jessica Holmes is at her home in Toronto. Jessica, you are looking fantastic. This pandemic has really exposed, though, how we all really look, right? How is the personal grooming going?
Well, you know what? When I only get out of my onesie once a week, you go all out.
You look fantastic. And you were telling me that you had your kids help with your look a little bit.
Yeah, one of my kids did my root color in preparation. What we didn't do was take down our Christmas tree.
All by myself in quarantine.
Comedy can be cathartic in dark times. How do you find humor in the midst of all this anxiety?
Us comedians say tragedy plus time equals comedy, or stress plus time equals comedy. So I have just learned to always look for the funny in things, to always imagine, where is the laugh track? If my life was a sitcom right now, where would the laugh track be? And that way it kind of takes the sting out of things, and knowing also that, a few months down the road, this will all be punchlines to late night jokes and stuff. For me, life is just easier that way when you're looking for it.
You've been very open to Jessica about your own depression, and you got through it with therapy and medication and building healthy habits. How are you handling life right now in this weird normal, and what would you say to other people who also have gone through depression, how they should handle the moment we're in?
Absolutely. To anyone who is feeling triggered by what's happening now, I'm so sorry. We will get through this a year from now. life will be calm again. It is triggering. The social isolation of it is triggering, not having our regular routine. So I would just say to people, hang on, I promise things are going to get better. We're going to feel better as we get more and more used to this way of life.
What's the funniest thing you find or have heard about the surreal situation that we're all in?
I've loved seeing how families are reacting to what's going on. And my favorite was this viral video that came out of England of a family taking on the characters of Les Mis.
One more day's home education. Let's just let them run amok.
The fact was, you could see that they had rehearsed it all day, and even the youngest kids had their parts to play. So I think it is a unifying experience right now.
For people who find themselves at home with nowhere to go, there's a lot of boredom, and you know, we can only watch so much Netflix. Is boredom a breeding ground for humor?
Donna, it is absolutely a breeding ground for that. And within 2 days of the isolation happening, I had my eyebrow pencil out and was drawn on a Tiger King sort of beard and mustache. And that has been my life, just dressing up as characters different days, or trying to find out what are other comedians online doing. For me, it's so beautiful to see how we come together through comedy, how regardless of how people feel politically and so on, that this kind of brings us together. We're all in it together, and comedy can break the tension beautifully.
There's a word being used a lot these days, hero. Doctors and nurses and hospital staff are heroes, but there's a whole range of other people getting the acclaim they deserve, from care workers to cleaners and grocery store staff and delivery drivers. There are about 180,000 truckers on the roads carrying food and other essentials. If they are indeed heroes, we haven't always treated them that way, sometimes doing things like denying them access to bathrooms. Lioness Woodstock is from Gatineau, Quebec. For work, he's a trucker, but in his heart, he's a husband, father, and grandfather, and he's a gospel singer with a lot of faith.
And you'll find that you don't have to walk alone.
The music is certainly something to go to. At a time like this, I don't think there's anything better.
In a vision of a much brighter place.
A month ago, nobody was calling us a hero. We were a necessary evil. We were stuck in their way. We were slowing them down on the 401. Now they're like, oh yeah, you go first. So it's great. Some people are calling us heroes. I don't see it that way. Quite honestly, I'm thankful to be able to make a paycheck. I feel quite lucky when somebody says, oh, you're such a hero. No, the heroes are the doctors and the nurses in the emergency room. I don't put myself in harm's way that I know of. They do. So as truck drivers, we're not heroes. I'm really glad that what we do helps the economy. It's a very important part, and that's exciting. It's great. It makes you feel good, but I don't think any of us wear a cape. Let me put it that way. Well, I started off in Mallorytown, Ontario, crossed the border, went down to Baldwinsville, New York, unloaded a load there. Went over to Liverpool, New York, just outside of Syracuse, picked a load up there, headed for Fort Erie, crossed the border, and now here we are in Mississauga. I'll drop this trailer here tonight, grab an empty trailer and head off to Kingston and basically do the same thing again tomorrow. But there are some places I don't feel comfortable going to anymore. Down in that New Jersey, Jersey City, New York City area, I want nothing to do with that area. I've been running out to Michigan, Pennsylvania, Ohio. Those places don't bother me too much. It's more rural areas that I've been running into, and there's less people, so less contact. I'm pretty self-contained in the truck here. I have my own fridge and my own food and my own coffee pot and my own bed and TV. So I don't really need to associate very much with people except to exchange paperwork. It's a changing world. You know, you try to sanitize yourself before you go in the house, and I take my clothes off in the laundry room and put them in the wash machine, and the dirty clothes that I have for the week. And then all my dirty clothes from the week, so that my wife doesn't have to touch anything, I throw it in there. Turn around and smile. Then she turns the wash machine on, I go to the shower, and then we spend the weekend pretty much sitting 4 or 6 feet apart all weekend, so it's certainly different. Doing our very best to keep the COVID-19 virus out of our house while we still get out to work and do the job of being a truck driver. We will never go back to the way things were, I don't believe. It'll be a new normal. This is just as important as the sanitizing we do when we arrive back home. I'm not really sure what the future holds. I do know it's going to be a very different Canada, a very different world. I have faith, I have a lot of faith, and I know that we will get through it. At least some of us will.
I thought to myself, now why is it I cannot see? Is this some sort of dream, or could it be reality?
It's still hard to believe we've been thrust into this life and death moment, and easy to think it's only older people who are really at risk. For the most part, that is true, but there are exceptions. Matt Greenshields from Okotoks, Alberta is one of them. He's 19 years old, and he's just come through the fight of his life. He is one of the youngest people in Canada to survive COVID-19, and he wants other young people to pay attention. Matt, hi there. I'm so glad you're feeling well enough to talk to us. You're a healthy 19-year-old. You started out that way, at least. Give us a bit of a timeline. You started feeling sick in mid-March. How quickly did it deteriorate?
Yeah, so I started feeling very mildly sick on the 12th, and then I came home to Okotoks. At the time, I was living on campus at University of Calgary. And then over the course of being at home, I felt like all my symptoms had gone away about 8 days later. And then on March 24th, so 12 days later, they all came back at once. And then I was admitted into the hospital on the 25th, told I had COVID on the 26th, and then told I had mono on the 27th.
And it was the combination, the doctors say, that made you so sick, and you ended up in intensive care. Describe how you felt at that point.
Well, physically, I was not doing so well. I was in pretty rough shape because I was so sick. But mentally, knowing that I was going into the intensive care was really hard to hear. I remember the doctors coming in and they're telling me, we're going to put you in intensive care for a potential tracheotomy. And I remember just not saying anything. I was just in total shock because, you hear stories about the ICU and what happens, and you never expect yourself to be in there. So it was terrifying.
And I guess at that point, you were also isolated from your family, right? They had to stay away from you. What was that like for you and for your mom especially?
Yeah, I was with my mom at the time in the hospital when they told me that the COVID swab came back positive, and I was actually asleep. And so my mom had to wake me up and break the news that she had to leave in 5 minutes. And so that was definitely the hardest point mentally for me, just knowing that I couldn't see anyone that I knew in probably the scariest time of my whole life. And just like, and the nurses too. I give my heart out to the nurse who had to give that news. It's just as hard for her to see that happen as it is for us to take it. And yeah, it was really tough.
So for people who are your age, give us a clear sense of how you were feeling, what this did to you, how you felt that night when you were in ICU.
When I was in ICU, I had never felt so scared and so physically ill in my whole life. And I had never expected it at all. Like, my tonsils and everything was swollen to the point where I couldn't communicate, I couldn't breathe properly, and I couldn't swallow. And so those three things alone are enough to scare. It was terrifying for me. And being so young, I never expected to be in that sort of a spot where I would need to be in intensive care. And so I guess it's a good takeaway to know that this really could happen to anyone.
Do you have any idea where you caught COVID-19?
That's a question that I would like to know as well. I don't have any ideas, but being at university and living on campus, it's such a diverse and international place that I must have just touched the wrong doorknob or something, just a freak thing that I'd never expected.
You know, you decided to go public with your story, I know. What is it you want young people to know about this virus?
Yeah, at first I didn't want to go public just given how graphic my own case was. But then I was aware of some people who were having small house parties and gathering still, like, around people that I know. And you know, it's tough for me to see that, knowing what I went through, and I don't want anyone else to have to go through that. So I decided to come out publicly with what happened to me to hopefully raise awareness more of my peers and say, you know, I don't know how I got it, and it could really happen to anyone.
Did you think at one point you might not make it, Matt?
Yeah, when I was being wheeled down to the ICU, I was definitely starting to finally question myself, because up to that point I was thinking, you know, I'm just going to get over it. It's just a sickness. Like, I'm young, I'm healthy. But being wheeled down to the ICU and being in those remote hallways where there's nobody, I was with my thoughts and I was thinking, you know, this is kind of like, this is scary now. And then while I was in ICU and all of my symptoms just exploded and peaked, and how much care I was being given, I was finally thinking, like, you know, I don't know how this is going to turn out. I don't know how this is going to end up. So that was definitely a very scary moment for me to think that.
Matt, you're looking great now. You're talking to us. What's your prognosis? How are you doing?
I'm doing much better now. I've had a lot of time to recover at home now. I've just been basically sleeping away the days, trying to get better as much as I can. But yeah, definitely better than it was.
Still ahead, from mission critical
80% of these food businesses might not survive the crisis.
To a critical mission.
These people are heroes. Anything we can do to make their life easier.
The new initiative feeding our healthcare workers. Plus, a powerful message.
To COVID-19, get the hell out of the way. To my family, I'm not giving up the fight.
The side effect COVID-19 is having on people waiting for transplants. And up next...
I went for 3 weeks thinking my father was fine. He's not.
Inside long-term care homes.
I think this is a massive wake-up call.
The warning signs ignored and rethinking the value we place on caring for our elders. I know some of you are watching anxiously, waiting for news, desperate to hear that your mother or father or husband or wife is still alive in their long-term care home. You're not allowed to visit, even phone calls are of limited use, especially if your loved one is nonverbal or has dementia. I get it. My parents spent their final days in a care home, and as harsh as it sounds, I'm relieved they passed away before this pandemic hit, because it is inside these long-term care homes that this coronavirus is taking hold and taking lives. Half the deaths from COVID-19 in Canada are in care homes. And in the most grim cases, people are left to die alone in their beds. And it's not like there were no warnings. The families dread the distance. When all they want is to be inside, holding a hand, all they can do is keep vigil outside.
4th floor, 4th window across, right up there.
Anything to catch sight of those dear to them, now isolated inside. Any precious sign, they're okay.
She's alive and kicking. That's what counts.
Like a wildfire, the coronavirus has blazed through Canada's long-term care homes, exposing cracks and faults in the system from coast to coast to coast. There are now outbreaks in more than 600 facilities, accounting for nearly half the deaths from COVID-19 in Canada, including the very first.
We unfortunately have had a death here in British Columbia.
It happened here at the Lynn Valley Care Centre in North Vancouver. And it was here, too, that a healthcare worker, a woman in her 50s, became Canada's first reported case of community transmission, a troubling sign the virus had taken hold among our most vulnerable. Public health officials rushed to trace her contacts and tried to contain the spread, but those who knew best feared the worst.
If you have people in your gathering who are elderly, who are more and I just know how stressful it is for our healthcare system, for my colleagues, and for families.
And then the pattern began to repeat elsewhere. At a small nursing home in Bobcaygeon, Ontario, nearly half the residents died in their beds, and at least 28 staff have tested positive.
It's a fantastic community, and to see this happening is heartbreaking. It's heartbreaking.
Soon, there were multiple outbreaks in care homes across the country, most with a common story. A sudden onslaught of cases, sometimes dozens of dead, testing and detection falling woefully behind the wave. Caregivers sick and off work, those remaining struggling to keep up in homes that were often chronically understaffed before this pandemic. Residents sharing rooms and bathrooms, staff lacking personal protective equipment, ideal conditions for a virus to run rampant.
Go in the bedroom, okay? In the bedroom? Mm-hmm.
Those on the front lines are mostly women, new immigrants, and visible minorities, doing difficult, deeply personal work for low pay. Bathing, feeding, changing adult diapers, it can be exhausting physically and emotionally, and they often work part-time in multiple facilities to make ends meet.
It remains at a critical low. We really need skilled workers.
In some care homes, there's been a collapse in frontline staffing. Some sick, some staying away because the risk is too high.
In my workplace, we all drop like flies. You have no idea how fast it infects everybody.
It's extremely hard for us because you grow attached to them. You don't want to refuse, but obviously a lot of people are going to feel unsafe.
Now hundreds of homes are locked down, leaving families worried sick, agonizing at the unthinkable, loved ones left alone in their final hours.
Here I finally get in. My father's on his last breath, literally dead, lying in his bed. So I went for 3 weeks thinking my father was fine. He's not. He's dead.
And there's the harrowing accounts of what happened inside Montreal's residence Heron. The conditions beyond words. Those who were still alive were dehydrated and malnourished and hadn't been bathed or changed in days.
Somewhere along the way, there had to be somebody to step in. A flare sent up.
Most staff had left. A doctor arrived on the scene so desperate, she called her own husband and teenage children to come and help. 31 residents died in 3 weeks. The government seized control of the facility, and the premier asked for help from the military. For a nation, it's a defining, shameful moment, exposing how we treat our elders.
Nos aînés nous lèguent une société qui...
Our elders, he says, struggled to leave us a rich and just society, a beautiful society, he says. We have a duty to protect them. The fact is, our long-term care system is built on a crumbling foundation. This pandemic has laid bare long-standing issues that, until now, we've chosen to largely ignore. Dr. Samir Sinha is an advocate for the needs of older adults. He's director of geriatrics at Mount Sinai and the University Health Network Hospitals in Toronto and architect of Ontario's seniors strategy. Dr. Sinha, first, do you think we have a full and accurate picture of the scale of outbreaks in care homes and retirement homes across the country, or have cases been underreported?
I don't think we have the accurate picture that we actually need right now about how things are progressing across the country. And that's for a bunch of reasons. Right now that some of the ministries, for example, have data streams and public health units have data streams looking at certain types of homes like nursing homes, but not necessarily retirement homes. So the official numbers that you see coming out in Ontario really only include nursing homes, but don't actually include retirement homes that are equally just as vulnerable and actually are more numerous than the retirement homes we have. So right now, the numbers you're seeing that really are over 1,000 homes across the country that are affected don't really give you accurate counts. And the same issues happening in the United States. And the problem with this is that if we don't have the accurate data, then you can't fight a fire blindfolded.
You know, what is the biggest failing, do you think, of our care home system that has allowed this virus to take hold with such ferocity?
I think the biggest issue that's really come to forward at this moment has really been the issue about the way we staff our homes. So, for example, many homes across the country they don't usually offer nurses and personal support workers who work in them the same wage rates that they would get working in a hospital. So it's no surprise that the majority of homes across the country tell us that they actually have trouble recruiting people to work in these environments, and then they have trouble actually retaining them, because often when a job opens up at a hospital, that often pays a better wage rate with benefits like pensions or sick benefits or sick days, for example, that people will jump ship and go there. So we have a real unstable staffing situation.
You know, the shortage of staff, the low pay, the fact staff work in more than one care home, none of that is new. All of it contributed to the spread. Why weren't those faults in the system addressed long ago?
You know, some folks are pointing back to the SARS Commission of 2004 that really focused on the issue that that staff working between multiple homes or in multiple settings was one of the reasons why SARS as a coronavirus was spreading between institutions and facilities. And so it's something that was recommended way back then that we actually eliminate that practice. And so former health ministers at the time who said, wait a minute, we made this recommendation back in 2004. Why did we never act on it? That's a great question, because now we're actually seeing that while it wasn't such an issue in the last number of years, because we didn't actually address that comprehensively, people have now been paying for it with their lives.
You know, I know from firsthand experience with my own parents that care home workers are like angels. They work so hard. They do incredibly difficult work. They do it with love and patience. Why don't we as a society value them more, pay them more? And do you think we will after this?
I think we have to. I think this is a massive wake-up call that as we age as a society, we're going to need more homes like these in the future. We should actually treat these workers, I'm not saying better than, but I'm saying at least equal to the way we actually respect and treat our workers in hospitals, because these workers are dealing with some of the sickest and most frailest people in our country. And frankly, when we don't treat them well, we all pay the consequences as a society, and these individuals with their lives as well.
You know, we've heard from people who say, I want to get my mom or my dad out of there. I'm so worried about them. I can't see them. What's your advice for people? Would you remove your parent from a care home right now?
If I was in BC and Alberta, I'd say I think they're getting things under control, and I think we need to make sure we can support our homes to support our loved ones well. But I'm nervous about people who have loved ones in care in Ontario and Quebec right now. And for those families who are thinking, well, we could possibly bring our loved ones home. The Ontario government back on March 24th actually changed the regulations to support families to do this if this was the right decision for them.
You've spent your career in the field of geriatrics, looking at aging and how to help the most vulnerable people in our society. When you look at what's happening in care homes in so many places in this country, what's your gut feeling to watch this unfolding?
It honestly, it's left me in tears at times because you know, I've dedicated my life to supporting older Canadians and enabling them. And when I think about, you know, the 400,000 vulnerable Canadians across these homes, and the fact that we as a country, in many ways, have let so many families and so many individuals down, it tells me that we should have been doing better, and that we can do better, and we have to do better.
One of the side effects of this pandemic is a sharp drop in life-saving organ transplants. Transplant centers across the country have massively scaled back as hospitals shift priorities to be able to handle COVID-19 cases. Living donor surgeries have largely shut down, and deceased donor transplants are happening only when the case is urgent. Sadly, that means many organs are not going to good use. And as Alison Vushnik explains, those on the waiting list keep waiting.
This is the only way we get to see each other.
At a distance, John Dennis waves to the love of his life.
It's okay, don't cry. I miss you very much.
Penny is living with dementia. Her long-term care home has residents sick with COVID-19. It's just too risky to visit for both of them. John has idiopathic pulmonary fibrosis and needs a double lung transplant. COVID-19 can be a killer, especially for someone with lung disease.
To COVID-19 get the hell out of the way. To my family. I want my family to know I'm not giving up the fight.
And John's the right guy for a fight.
I don't know if they can see that on the camera.
An avid adventurer, he even competed in an around-the-world sailing race. He's now in the fight of his life.
I need it. Oh, I need it. Yeah.
If all goes well, John would travel from Halifax to the Toronto General Hospital for transplant. This is the largest transplant program in the country and one of the top in the world. This is a center of innovation and life-changing surgeries. With the COVID-19 wave coming, on March 13th, the hospital announced it had to scale back transplants. Heart, liver, kidney, pancreas, and lung delayed unless a patient is rapidly deteriorating.
When we do a transplant, we put patients on anti-rejection pills, and that means really knocking down their immune system. And we're very worried if we do that to patients, and then if they get COVID, they'll end up with very, very severe manifestations of COVID.
That also means COVID-19 patients and transplant patients could end up in the same ICU, both needing ventilators. Spreading the virus is a concern.
COVID seems to also infect the liver and the kidney and the heart, so we're very concerned about that.
In early March, Jim Mann finally got the call that he's officially on the transplant list. Soon after that, another call about the delays. Jim needs a double lung transplant for severe emphysema.
The COVID-19 is what scares me more than the surgery. They've told me if I got that, then my chances of survival are very, very minute.
You feel really let down, and it kind of breaks your heart because we had that hope, and then it's kind of like, oh, it's on pause, and nobody knows how long this is going to go on for.
So for Jim, outgoing, fun-loving, and always willing to help a friend, is inside protecting himself while he waits.
Every time the phone rings, still, even though we know it's closed, I still have a little bit of hope that that's what it is.
And it's not just in Toronto. Transplants are on hold or reduced at centers across the country, leading doctors who refer patients to worry.
This does have a huge impact on my patients, but all transplant patients in general across Canada. There's multiple effects. So there's patients right now who are very unwell and getting sicker quickly.
Another devastating consequence is that with programs across the country scaled back, so too is the procurement of donor organs.
So essentially those organs are not used, they're lost to the system, which is really another tragedy due to COVID. So it's very heartbreaking, actually.
Hundreds of Canadians die every year waiting for a transplant, and now COVID-19 is making that even tougher.
The number of patients on the wait list is growing, and that will create a backlog.
During the last month, Toronto General has performed more than 15 urgent transplants with safety precautions in place and testing all donor organs for COVID-19. All the precautions and gained knowledge is leading to renewed hope. Dr. Humour says he's actively working on how to increase the number of transplants performed and is optimistic that can start soon. Until then, Jim and John are staying safe and hopeful.
I know there's a fix down the road. It just, hopefully it comes before I can't go on anymore like this.
I know it's getting worse. I just hope I can make it to Toronto. That's all I ask. Give me a chance.
Coming up,
it's been very hard for her. There's a lot of tears, a lot of reminiscing.
Grieving in isolation.
It's unnatural, but it's becoming the new natural.
The emotional extremes and physical distancing taking a toll on Canadian families. Not everyone with the coronavirus gets sick, and of those who are sick, only a small percentage die. The infection fatality rate varies widely. It's as high as 13% in Italy and closer to 3% in Canada. But none of that, of course, means anything if your loved one is one of those statistics. COVID-19 is so infectious, people are often dying alone. And as Ross Lord reports, those left behind are grieving alone.
3 weeks have passed since the death of Sofia Lasinski's brother, Anthony. Their family is unable to grieve collectively because the threat of COVID-19 has forced her elderly mother, Enid, into isolation.
It's been very hard for her. You know, we speak probably 2 times a day, and
stay connected with each other that way, and there's a lot of tears, a lot of reminiscing.
The family of Ken Wieland can relate. For 2 weeks after he became infected with COVID-19, he was completely off limits. Standard policy aimed at limiting the spread of the virus.
We were astounded that we couldn't, it's like they had taken away my father and locked him up. That was that was the way I felt about it, and my brothers and sisters felt about it.
In the end, they were finally allowed a short visit to see their father just before he passed away. The emotional extremes, combined with the constant stress of life during a pandemic and the edicts around physical distancing, are taking a toll on Canadians, according to this grief counselor.
There's definitely a phenomenon of survivor's guilt, and guilt in general of not being able to say goodbye or what I could have done differently.
As the virus sweeps through long-term care homes across Canada, so does a feeling of isolation and sorrow that natural gestures of compassion are forbidden.
And you find yourself taking that initial step forward, and then you have to say, whoa, and step back again. And it's unnatural. But it's becoming the new natural.
For Reverend Bill Mercer, it's heartbreaking. Life-affirming gestures are all he knows.
I baptize you in the name of the Father and of the Son, and of the Holy Spirit.
Suddenly, the choirs and the congregation are gone, leaving only a lonely live stream.
However, these are different times and different circumstances.
In his province, Newfoundland and Labrador, most COVID-19 cases have been traced to a single funeral home gathering. Funerals and wakes are banned. No more than 5 people are permitted at a burial. Even informal processions have been shut down because people started gathering in groups on the roadside.
When I see a family at the graveside, my initial instinct is to, either to extend a hand, say, I'm sorry for your loss, or, if you know someone, even on a closer basis, to offer a hug. And at this time, we're just not allowed to do that. And you wrestle with it, you struggle with it, and at times you hate yourself because you're not able to do it.
It's not only grieving that's restricted. Distancing rules are stifling those once-in-a-lifetime moments, like first-time grandparents touching a precious newborn.
Then when I found out that none of us could see him, none of us could go in and everything, it was just like, this can't be happening. This just can't be happening.
And they took him out of the car, in his car seat, plunked him on the driveway, and said, okay, you can't come any closer.
For now, they'll get by watching videos of their grandson Nico emerging into this world. Those suffering apart from loved ones who are dying face a much more excruciating ordeal.
If you're grieving, know that you're not alone. We are here for you.
Sophia Losinski is finding ways to remember her brother.
I have Anthony with me right now. These are his gloves, and we're holding each other's hands. Even though he's not here, he's with me every single day.
She wants desperately for her entire family to mark her brother's death and scatter his ashes together.
We're going to hold each other, and we're going to cry, and we're going to laugh, and we're just going to be shoulder to shoulder.
There's no way of knowing when that will happen, as Canada struggles to withstand this crisis and Canadians struggle in isolation.
Still ahead,
here we go.
The special concert series led by Canada's country queen.
Hey, honey, I'm on my way.
And
our mission is really, really simple. We're trying to save small food businesses.
Sustaining the line.
We want to give our time and our food to the frontline workers.
Canadians coming together to help each other. One of the things that sustains us through this is food. Lots of us are cooking more, maybe eating too much, but plenty of restaurants have either closed or are struggling to survive doing takeout. But everybody's got to eat, including healthcare workers who are run off their feet. So as Abigail Beeman reports, a new initiative put 2 and 2 together to sustain the line.
Thank you.
That'll look all right.
Yeah.
In a flash, COVID-19 changed everything for this couple, right on their Toronto restaurant's 3rd anniversary.
Going from earning or making a living rather to making nothing, being very scared, waking up in the middle of the night in cold sweats.
But while figuring out how to pay the bills, feed their children, get their laid-off staff hooked up with employment insurance, and launch a delivery service, somehow Vera Tsoulas and Chris Priftis found the time to think about others in need.
We need to get to the hospitals. We want to give our time and our food to feed the healthcare workers, the frontline workers.
That's right. While facing their own frighteningly uncertain future, the owners of Fat Lamb Cuisine wanted to donate to healthcare workers.
These people are heroes, you know, they need anything we can do to make their life easier.
They couldn't quite figure out how to do it alone, but fortunately, a small team was already cooking up a solution.
Our mission is really, really simple. We're trying to save small food businesses because 80% of these food businesses might not survive the crisis. At the same time, we're trying to feed really deserving frontline healthcare heroes.
Aaron Solomon is a native Montrealer and one of the guys behind Sustain the Line. The pandemic initiative pairs restaurants ready to deliver with people across North America who want to donate meals to healthcare workers. Donors like lawyer Darlene Tonelli.
I really feel for people who still have to go to work and without whom none of us could function.
When she heard about Sustain the Line from another law firm, she encouraged her own to get on board, and they did.
Just a minute to get out of our own heads and our own worries and think about other people, I think is what the team gravitated towards.
All right, here we go.
Her firm has already supported 2 restaurants, including Fat Lamb Cuisine. On this day, they're dropping off 30 meals at North York General Hospital.
Beef feta arugula salad.
Thank you.
They're all there.
It means a lot to receive meals like this. It nourishes our bodies. Our doctors are working 24 hours. Our anesthesiologists go to codes. They work in ICU, Emerge, the OR. Our nurses are being redeployed. Our nurses are working in the recovery room 24 hours as well.
Solomon is busy. He estimates Sustain the Line has already seen more than $100,000 in donations in its first 3 weeks. Donors are stepping up across North America in a number of American and Canadian cities. The list is growing. The project doesn't take a penny for any of it.
I think that crisis like the coronavirus crisis brings out both the worst and the best in people. And I think we all have to think for ourselves, what side of ourselves do we want to have brought out? We see the good that this is doing literally every hour.
We gave them our name and sort of, hey, we want to be part of this. And all of a sudden, boom, we have donations.
Already delivering to hospitals, Fat Lamb Cuisine says long-term care homes are next. And Sustain the Line says they're happy to feed the idea to others who want to help more essential workers.
If you out there would like to copy what we're doing, contact me and I'll help you set it up. If you want to do it for grocery store workers, you want to do it for paramedics, go ahead and do it.
Solomon says it's important for people to understand the need isn't going away anytime soon. Neither, it seems, is the desire to give back.
Coming up, the healing power of music.
We rise again in the faces of our children.
A choir of women physicians singing for the superheroes. Plus,
This job ain't worth pay.
the COVID causes that have our country's superstars singing from home.
Thank you for being you and everything that you do.
That is Canadian country legend Shania Twain honoring healthcare workers with a touching song from home. She's among a number of huge country stars joining forces for a special 5-night concert series this coming week on ET Canada. It's called Canada Together in Concert. In partnership with the CCMA Foundation, anyone can donate, and the money will go to Food Banks Canada and the Unison Benevolent Fund, which provides counseling and emergency relief services to the Canadian music community.
It is very trying times, and
I'm feeling very lucky because I'm not sick. Concerned about the healthcare givers, the first responders, everybody that's putting themselves out there.
Canada Together in Concert starts tomorrow night on ET Canada. And if doctors don't already do enough saving lives, we thought we'd leave you with some who will also soothe your soul.
We rise again in the faces of our children. We rise again in the voices of our song. We rise again in the waves out on the ocean.
This is Voices Rock Medicine, a Toronto-based choir of women physicians. It's their tribute to what they call the superheroes of Canadian healthcare and beyond. Take care of yourselves.